The next speaker is Dr. Suganya on retinochoroidal manifestations on multimodal imaging, management of choroidal osteoma, long-term study.
Good morning. My paper is on retinochoroidal manifestations on multimodal imaging and management of case series of choroidal osteoma. Introduction. Choroidal osteoma is a benign ossifying tumor where mature bone replaces the choroid, mostly asymptomatic. Females are mostly affected, mostly unilateral, and affects teens or people in early 20s. The purpose. Choroidal osteoma is a rare benign tumor causing visual decline over time due to various macular complications like SRF, CNVM, decalcification, etc. We analyze the demographic variables, clinical manifestations, multimodal imaging features, complications, and management of choroidal osteoma. So methods. This retrospective single center study included 19 eyes in 17 patients of choroidal osteoma. The demographic variables like age, gender, laterality, and retinochoroidal manifestations and multimodal imaging were studied. All patients underwent multimodal imaging like fundus photo, autofluorescence, OCT, OCTA, ultrasound, FFA, ICG. Functional outcome included BCVA at baseline and final follow-up. Results. The range of age group was 19 to 79 years, mean age 37 years, mean follow-up of 36 months. Clinical manifestations. 10 patients were asymptomatic and 7 patients were symptomatic. Gender ratio. 35% were males and 65% were females. Laterality. 2 patients had bilateral presentation and 17 patients had unilateral presentation. Location. Peripapillary lesions were seen in 4 eyes, submacular lesions in 9 eyes, and extramacular in 6 eyes. The fundus photo showing the peripapillary, submacular, and extramacular locations. Coming to the clinical findings, non-neovascular SRF was seen in 6 eyes, and neovascular SRF was seen in 3 eyes. Type 1 CNVM in 5% and type 2 in 11%. The significant OCT findings, horizontal lines were seen in 4%. Horizontal choroidal lamella were seen in 9 eyes, vertical choroidal lamella and tubules in 3 eyes, multiple hyperreflective dots with hyporeflective spaces in 4 eyes, cement lines in 4 eyes, speckle compact bone in 5 cases, choroidal localization of fluid in 1 case, choroidal cavern in 1 case. So these are the OCT findings showing the choroidal localization of fluid, multiple hyporeflective dots with hyporeflective spaces. It's a choroidal cavern with RPE atrophy. Treatment. The spontaneous resolution of SRF was seen in 1 case. Successful resolution post PDT was seen in 1 case. Anti-VEGFs were given in 29%, out of which 12 cases were recalcitrant, and there was complete resolution with aflibercept switch in 1 patient. So, case 1. The patient had peripapillary choroidal osteoma involving the macula. She was not willing for anti-VEGF agents. She was advised observation and she came back after 6 weeks, and there was spontaneous resolution of SRF. So case 2, patient had left eye choroidal osteoma nasal to the macula with subretinal fluid. Octa showed network in the RPE fit, which was suggestive of choroidal osteoma with type 1 CNVM. She didn't respond to conventional anti-VEGFs, but she showed complete resolution with aflibercept. This is a case 3. Patient had choroidal osteoma with subretinal hemorrhage. She underwent PDT. 1 month later, there was complete resolution of CNVM and there was resolution of subretinal hemorrhage. We can see staining of the scar tissue post treatment in FFA. So systemic associations. Erdheim-Chester disease was seen in 1 case, ocular syphilis in 1 case, and high myopia in 1 case. So conclusion, the newer multimodal imaging findings helps in early diagnosis, precise and early detection of complications of choroidal osteoma resulting in visual decline including CNVM, non-neovascular SRF decalcification, and helps in effectively managing them. So choroidal osteoma per se needs only close observation. Anti-VEGF agents are the first line of treatment in SRF related to osteoma. The presence of SRF in the absence of CNVM may resolve spontaneously or respond with anti-VEGFs, or it may be resistant to injection. If associated with CNVM, then anti-VEGF agents are the first line of treatment. Newer anti-VEGF agents can be tried in refractory cases. Thank you. Sir, aflibercept we have tried in one patient, sir. So patient was initially treated with brolucizumab and ranibizumab. Sorry, bevacizumab and ranibizumab. She didn't respond. So we then switched to aflibercept. She showed complete resolution and the effect persisted for more than 3 months, sir.
So I have just two questions. One is that did you find any novel findings during multimodal imaging in choroidal osteoma that have not been reported in the literature?
Ma'am, everything is already there in the literature, ma'am. We had a choroidal localization of fluid in one patient, choroidal cavern in one patient. Other findings were there, conventional findings only, ma'am.
Okay, and did you also study the visual outcomes?
Yes, ma'am, we studied the visual outcome, ma'am.
So how did it respond to treatment?
So recalcitrant patients were there, ma'am. 12% were recalcitrant. So 5% responded completely to PDT.